Good afternoon, good evening, and welcome to this podcast being run by the Global Leadership Exchange in Mental Health. My name is Peter Molyneux, and I'm the England lead for the Global Leadership Exchange in Mental Health. This is one of a series of podcasts we're doing with leaders globally along the theme of ideas into action, inspiring leaders to mobilize collective solutions. And I'm absolutely delighted to welcome today Professor Linda Lamb. And Linda, perhaps we could start by asking you to introduce yourself a little bit.
Hi. Okay, Peter. Uh, Thank you very much for asking me to join your podcast. I'm Linda Lam from the Department of Psychiatry at the Chinese University of Hong Kong. I grown up in Hong Kong, educated in Hong Kong, and work as a psychiatrist for the past 30 years. My main research areas has been in old age psychiatry, in particularly early detection and management of cognitive and also mental health problems in community living elders. And for the research projects that I have been doing, I have a strong interest in doing lifestyle intervention, particularly how cognitive activities as well as physical exercise may modify or improve one's cognition as well as mood when one gets a bit older. So for the past many years, I've been working on that. And currently, I also work on a regional organization called Asian Society Against Dementia, where I have constant exchange with colleagues, neurologists, psychiatrists, psychologists, uh, other geriatricians all over Asia in different countries, so that we have exchange on how culturally adapted interventions may be more beneficial.
Fantastic. Thank you very much. So maybe we could start by me asking you, what do you see the particular challenges facing you as a leader at the moment, and what do we need to do to address these?
We have been talking about this with our colleagues for the past 5 years, and there is a gap for people who are the leader, how we generate the succession of people who are equally interested in clinical as well as academic career in psychiatry. And we see it as a problem not only in Hong Kong, but also in other cities in Asia, like Singapore and even in Australia. Because working as a psychiatrist in the clinical field is already quite challenging. And additionally, if we want to add a component of academic clinical pathway, that would be even harder for many of the young people. So now our challenge is to find somebody who is interested to be a clinician scientist, especially take on a career on clinical psychiatry, not only basic neuroscience, as well as doing research on the clinical aspect. And so for me and for our friends, this is the biggest challenge, how to attract people into the career. And what we have been doing is to try to charm medical students who are interested in psychiatry to do a bit of research in the undergraduate years. But we are successful in Hong Kong that many people want to do psychiatry, and the people interested in to do psychiatry actually outnumber the places that the government agrees to offer for the training positions by at least two or three folds. But we are not able to charm enough academic psychiatrists. That is one of the problem. But on the other hand, it is good that my research area is on aging. It's not only psychiatry. Many other people who are interested to research on aging population would join the research field that would be equally important, except when we are talking about the clinical aspects, when we want to serve the clinical populations, that is one of the challenge that I would want to say.
Mm. So when we think about your area, what do you think some of the big challenges are at the moment in your area of specialism?
Uh, Let me take interventions for healthy cognitive aging. Uh, we are For the past 20 years, there's a lot of research on lifestyle intervention, on cognition, dementia prevention. There's a lot of lifestyle research. But the problem is because lifestyles are very diverse. You can have exercise, you can have leisure time activities, you can have sleep rhythm, diet. Many of them are so non-specific. So to make the research methodology scientifically sound is a difficult part. We can do any type of interventions for supposedly good lifestyles, but how to do it in a way that you can test what type of lifestyle really helps with what kind of people, it is a challenge. But for the past 10 years, I think the availability of biological markers such as the neuroimaging markers, as well as the blood-based markers for neurodegeneration, actually help us to streamline because it's important to select people, different groups of people who may be more beneficial for different types of lifestyles. I take an example. And if we are working with lifestyle intervention for people who are having preclinical Alzheimer's disease, then now we have biomarkers, blood markers for possible Alzheimer's, then we can select them more appropriately. Whereas in the past, we have a group of people joining the same program, and because of heterogeneity, that affects the outcome evaluation. So that actually is why many of these lifestyle interventions seems to have a bit of positive effect, but you may ask, so what? Then what's next? So even for the many systematic review meta-analysis, the effect size, the degree of certainty is always like doubtful. We need more research. But now I hope the next generation researchers can incorporate appropriate biomarkers to guide lifestyle intervention, which I believe would really work.
And do you think we're thinking sufficiently hard about what it means to have an aging population? Do you think we've fully embraced the idea that we are going to have people living into more people living into advanced old age?
Uh, I don't think we are prepared enough because there are diverse opinions because the aging population actually increased very quickly. It's exponential. Uh, if we can see people who are 80 years old, uh, 10 years ago, you expect them to be basically physically or cognitively limited. But now it's only 10 years. People over 80, many of them actually are physically and cognitively very capable. So we need to think from the perspective of how to um, consider that we have a group of people who are aging, moving, the baby boomers, moving into the geriatric group, but they are actually still cognitively fit, physically fit, and they have a lot of aspirations. And so, how could we accommodate the needs of these healthy baby boomers? But having said that, many of these new young old people actually needs to take care of their physical health. In order to be very independent, we have to take care of our physical. Many of us have chronic medical problems. And so this aspect of being fit but medically requires some attention needs to be considered in parallel. So we have to tell people that if you manage your diabetes or hypertension well, you will be very active, very well, and this persists into 90, even 100 years old. So long-term studies are looking at the profile of people with cerebrovascular disease, cardiovascular disease, and how they thrive into late age actually suggests that if you manage your problem well, and it does not affect a lot about your function. So I don't think the society is well prepared for having a group of people who might have a bit of medical problems to manage, but they can live functionally very well. But on the other hand, we need also to think about people who may not have the chance to manage their medical problem very well, and they deteriorate. It's
Mm.
not only for the medical, but also for the cognition and mental health, and they become dependent. So I think actually I have always suggest to the policymakers and that we need to take care of people in need. We need to take care of people who are medically and cognitively dependent or compromised in the community. But we need also need to prepare how to tackle the needs, the psychological needs, the social needs, and the medical needs of people who are upcoming and they are still very capable and they have high expectation of what the society or the community or even the policy are there to help them. And take a very brief example in like in a social center for elderly. In Hong Kong, we have a lot of social centers for the elderly because it's a small place. And people who are university graduates, elders, would not like to go to these centers for elderly because it looks like it's a very backward. It looks like that uh, they feel is centuries behind what they expect. What they want and elderly centers to be like is they have a lot of computer facilities, physical gyms, a lot of personal space, and that is still not an agenda in our society for the time being.
Yeah. So is there something that you're particularly proud of in terms of the work that you've done, or things that you think that people could really learn from what you've done in Hong Kong?
I think I am quite proud of the fact that I actually introduced physical exercise intervention
Hmm.
and also cognitive training. I have been running physical exercise intervention and cognitive training research for the past 15 years. And with the funding support of a donation, a family donation, it actually spread to over 300 social centers. The model which we designed to help uh, people with some cognitive complaints design their leisure activities. We have packaged or to help them to decide in a week what should you do for physical activities and what should you do for intellectual activities. And you can do it partially at the center and partially at home. And this type of regime has been disseminated for over 90% of the elderly centers in Hong Kong. I'm one of the chief investigator for that 15 years ago. So this is something that I'm proud of,
Hmm.
and and the other is I advocate the evidence-based approach to lifestyle intervention by doing randomized control trial, um, learning through the service user, the elders, and talking with them, and then I design the paradigm and do it in a stringent randomized control way so as to demonstrate the effect on cognition and mood. So this is something that I'm quite proud of.
Mm.
Though it does not sound very glamorous, but I think it's practical.
Yeah.
Mm.
And something that people can do,
Yes, yes, yes.
which is good. So are there particular issues with the different communities in Hong Kong or within Asia? Are there particular issues that are different perhaps from elsewhere?
Um, I would like to take it from the perspective of Asia because
Mm.
I have regular academic exchange of colleagues all over Asia. I think my Asia colleagues, and I agree with them very much, is that the family ties in Asia is having a divergence because deep down for the young people, not very young, the middle-aged people, and they still care for their parents. But they also need to take care of the younger population. But in terms of urbanization of the cities, the family becomes smaller. So the ambivalence of the adult populations in how to relate to the elder parents who might have dementia or other mental problem, physical problem, and yet they are living apart and need to take care of or need to relate to the younger populations is one of the challenge of most Asian societies, not only in Hong Kong, but also in places like Taiwan, Bangkok,
Mm.
Thailand, India, and Indonesia and Korea. They're all the same. So this is one of the particular issues, the family ties, the ideas of respecting and taking care of elders still there, but then the younger generation already moved to live with their nuclear families. But that would create ambivalence in the mind and make it uh, a bit difficult to manage psychologically. So I would advocate carer support programs to be developed well, and that fits into the geographic and also economical and also the social demographic profile of this city, of different cities would be very important.
Yeah, yeah, that makes sense. So we, at the moment, we feel we're working in very uncertain times. Do you think there are particular leadership challenges that come with that feeling, those feelings of uncertainty?
Oh, sure. Because everything seems to be so uncertain.
Mm,
The environment, the economic environment, the social environment, and the international relationship seems to be pretty unpredictable. And as in terms of the leadership challenge, it's very difficult for us to discuss with younger people who want to pursue a similar career path that with a predictable outcome. So the work is difficult. It's already challenging. The research work, the clinical work is already challenging enough, but they could not see the outcome. Like in 10 years' time, what would they be? Would they be working in Hong Kong or elsewhere or in mainland or elsewhere internationally? This would create a big uncertainty. But I try to discuss with them that we can see the world in a global perspective. Uh, my daughter used to tell me that she is a world citizen. She tell me, you probably are more Chinese lady. I'm a world citizen. I want to see the world. So give me some time to explore the world. So I try to learn from what she said and talk to my juniors that even if you have a plan, you do not need to think for 30 years. You can think about the work that you're doing would benefit people anywhere. And if you stay here, you work and serve people in this city. If you want to explore elsewhere, just go, bringing what you have learned, your expertise, and serve people out into in other places. That's for me and for them is equally meaningful.
mm.
That would help to alleviate a little bit of anxiety because Chinese people used to be very conservative. We want to have a predictable path. To think out of the box, you need a lot of challenge.
So what advice would you give to someone starting out now?
Um, I'm talking from the perspective of OH psychiatry or OH mental health.
Mhm.
Um, I would highly suggest people who are starting to think about uh, carer support because a bit something carer support is missing in the whole picture. We always talk about carer support for the elderly, but if the carer support just focus on the logistic support, that will be important, like they Meals on Wheels, home care, escort service, respite care. These are all important social support. But if we don't go into the heart of what the carer's psychological needs are, so is whatever program we implement would be at least half-hearted or is very difficult to succeed. Like what I'm talking about, lifestyle and intervention, physical exercise of cognitive activities. If we are just thinking from the perspective of people who do these activities without thinking that it should be much better if the carers agree and help. So I would highly suggest people who are starting in this perspective to go into carer support, psychological support, explore the psychological distress, the difficulties that carer face, and how to help them. And I believe because everybody actually is a carer, I can't find anybody who is not a carer. If we are able to handle the inner distress and the psychological conflicts that a carer face, and have some carer support intervention, whatever it means, and it actually would improve the mental health and mental well-being to the greater community, not only to the older people that I'm working with for many years. I hope it's useful.
Professor Linda Lamb, thank you very much indeed. Thank you.